Today is today is October 10th, October 8th, 2020. My name is Cristian Doña Rebeco, and I am interviewing Laura Contreras for the Conversaciones Oral History Project, Voces of a Pandemic project at the Office of Latino and Latin American Studies and Chris Library at UNO. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Ms. Contreras, that this interview will be placed in the University of Nebraska at Omaha, Dr. C.C. and Mabel L. Chris Library, and share with the Voces Oral History Center at the University of Texas at Austin. If there's anything you do not wish to answer or talk about, I will honor your wishes. Also, if there's something you want to talk about, please bring it up and we'll talk about it. Because we are not conducting this interview in person, I need to record your consent. So I'll ask you a series of 6 questions. Please say, yes, I agree, or no, I do not agree after each one. There are several questions we need to make sure you agree to before we go on. The Office of Latino and Latin American Studies and Chris Library wishes to archive your interview along with any other photographs and other documentation at the University of Nebraska at Omaha's Dr. C.C. and Mabel L. Chris Library. UNO's Chris Library will retain copyright of the interview and any materials you donate to the Office of Latino and Latin American Studies at the University of Nebraska at Omaha. So first question, do you give the Office of Latino and Latin American Studies consent to archive your interview and your materials at UNO's Chris Library?
Yes, I agree.
Do you grant UNO's Chris Library right, title, and interest in copyright over the interview and any materials you provide?
Yes, I agree.
Do you agree to allow UNO's Chris Library to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
Do you grant the Office of Latino and Latin American Studies consent to share your interview and your materials with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voces of a Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes, I agree.
We have many questions in the pre-interview form that we have already filled out. We use that information from the pre-interview form to help in research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends it to the Benson Library and to Chris Library, we would have stripped out any contact information for yourself or family members. So that will not be part of your public file. Your public file will only be accessible at the Benson Library and at Chris Library. Do you wish for us to share the rest of your interview in your public file available to researchers at the Benson?
Yes, that's fine.
And finally, on occasion, the Office of Latino and Latin American Studies and Voces receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
Yes, I agree.
All right, so thank you very much. And Laura, can you tell me a little bit about yourself? You know, where were you born? Where do you go to school? What do you do in your work? About your family, anything that you think is important about you?
Sure. I was born and raised in Schuyler, Nebraska, and grew up, I guess, in that rural town with a pretty diverse town. It's I guess a meat packing town, if you would want to call it that. I graduated from high school there, and then I came to UNO 2012 and I got my BA in psychology, and I intended on going back to grad school for school psychology, but I started working in the nonprofit sector here. I started after graduation from college. I worked in child welfare. And then I started working.
That I didn't hear you.
Sorry, yeah, you're cutting out too. Which part, do you want me to start over?
No, if you can tell me where you started working at right after college.
Oh, okay. All right. So yeah, after college, I started working as a contractor for Child Protective Services. And then I did that for about a year. And then I started working at Lutheran Family Services after that. And I've been with Lutheran Family Services for about 3.5 years. And I started working there as a family liaison, where we did a lot of work with kind of basically working in North and South Omaha to help bridge some gaps between the families and the school districts. So we were kind of like, I guess, family advocates in a way within the school systems. And so we helped facilitate communication, like when there were language barriers or just relationships that weren't there. And so we would also kind of attend meetings with them and make sure that the parents knew what their educational rights were and all of that. Um, and then after that, our contract kind of came to an end with the learning community, and at the same time, the opportunity for this migrant support services program came up. And this one is a national contract where several cities are implementing this program. And right now, Omaha is one of the pilot cities, along with Atlanta and Washington, D.C., where we are basically, we're using some congressional dollars that were allocated for family services for undocumented immigrants. And so with that, we're able to provide free therapy for undocumented people that usually don't qualify for some of that federal assistance. So that's what I'm doing now. I'm overseeing and growing that program.
And what populations do you work with? You said undocumented migrants. Are they mostly from Central America and Mexico, or other countries as well?
Yeah, mostly Central American. Obviously, a lot of people from Mexico, Guatemala, Honduras, El Salvador. We have some that are from other refugee countries, usually for kind of overstaying, or maybe renewal didn't get accepted or something like that. So some of them are from other countries.
Thank you.
Mhm.
And so we've been in this pandemic for almost 9 months or so,
Mhm.
or 10 months. Tell me, when was the first time you heard about COVID-19?
It was probably early, well, like late February, because I was supposed to go on an international trip. And I was keeping an eye on the news and kind of hoping that it wouldn't get canceled, but it did.
And what was your initial reaction? So about
I
what was
guess initially I was just, initially I was just hearing that it was happening in other countries, and I was like thinking, oh, well, you know, in the United States, it's not really going to affect us much. It's just a issue of another country. And then it started to kind of just spread worldwide. And so I think just, yeah, kind of gradually got a little bit more worried about it.
And when did you realize that this was really serious, and how did that impacted your work?
Um, on on March 16th, I want to say, it was a Sunday night. That's all I remember. We got we have a mass text message system at work. And so that night, um, they sent us a text message saying, you're not coming back to work tomorrow, or back to the office tomorrow. So that's kind of like that. I think before that we had a staff meeting um, that virtually, and they kind of just told us to keep an eye on it. But then, yeah, that Sunday night was like, okay, it's real. So we're not coming back to work.
And are you still working from home?
Yes. Yep. I've been working from home the whole time.
But your office still is it open, or is still closed?
So the whole organization is virtual except for one program that is our immigration legal team. They have to see clients in person to fingerprint them for legal purposes. And then also people that have to go in, like usually executive leadership will go in and sign checks or things for finance.
So tell me a little bit about how has this impacted you in your everyday life? You mentioned some point that your father had contracted COVID-19. Have you been back to Schuyler? You have not been back. Tell me a little bit about that, please.
Yeah, I was concerned initially because both of my parents work at a meatpacking plant in Schuyler, and so I was pretty worried because I have thousands of employees, and so I just knew I knew at some point they were going to contract it. But then, yeah, my dad he got pretty sick for a couple weeks. He was, I think, for one full week he was bedridden, and then the other one he just had like lingering symptoms, and so. That was pretty concerning. And I didn't go back to visit for a while. I think I want to say on Mother's Day, we did like a socially distanced thing in the backyard. And then I've gone back like on like my siblings' birthdays. But yeah, I try to limit as much as possible just because they still go to the plant and interact with a lot of people.
And so when did your father get sick? It was early, it was before early March or in mid-March, late April?
I want to say it was May. Yeah. I believe his more severe symptoms were late May.
Okay. And your mother, at least she didn't present any symptoms?
No, she so no, she didn't. She is a little bit more careful about wearing her mask, and she wears a face shield at work too. So for her, she was a little bit safer about it.
And they're both back at work?
Yes, yep.
Mm-hmm. And so what about your siblings? Do they go to school or?
Yeah, so my older sister lives here in Omaha. She actually works full time, but she works for a tech company, so she works from home. And my younger sister had just graduated in May. And she actually didn't work this summer, and she just started working at a lab in David City, Nebraska. She's a biology major, so she started working at a lab. And then my little brother, he's in high school, and he actually he goes to high school in Schuyler, and so they never went remote, so he's still going in person.
Mm-hmm.
Yeah.
Mm-hmm. And you also belong to MILPA, the Metro Young Latino Professional Associations. Did any of the activities you had planned change?
Yeah, normally from March to about May, we do really heavy fundraising for our scholarship for Dreamers, the Somos el Futuro scholarship. So that kind of derailed some of those plans. And we also usually have a luncheon around that time as well to kind of recognize the recipients of the scholarship. So we couldn't have that either. We had to do a lot of our fundraising. We still did fundraising, but we did it more over the phone and just virtual efforts in that sense. And then every month we used to do networking events for professionals in the area. So we haven't had any of those really. We kind of had to shift to doing more, like we've done mask drives, like where we just give out free masks, have people like, drive up and pick them up and not really do any networking anymore.
Mm-hmm. And how did the fundraising go in the current condition? Was it as good as other years, or was significantly bad?
It wasn't, I guess it wasn't bad or great either. Like it was, we were able to, since we weren't spending a lot of money, we were able to roll over a lot of the revenue from the previous year. Um, some that we didn't get to use for events that we had planned. So we just rolled it over. Yeah, and it didn't really impact us too much in that sense.
Mhm. So tell me a little bit how it has impacted your work and your organization. So you work with migrants, you work with undocumented migrants, you work with some of the population that is the most hardly hit by this pandemic. So tell me a little bit how has it impacted?
Yeah, it actually, I feel like it, so this migrant support services program is really a great, perfect resource for people, especially during the pandemic. And it wasn't planned. We had been talking to the national contractor since January about implementing this. And so it just happened to work out. But yeah, I feel like as far as actually seeing clients, we have a lot of work that needs to be done there. So we're getting a lot of clients referred over to us because a lot of them are people that are cooped up at home, especially in the Latino community. A lot of the women are stay-at-home moms, and from some of the sessions that I've heard about or been able to sit in, they've just been really isolated, and it has kind of impacted their, I guess, exacerbated their depression or just feelings of like loneliness. And yeah, so that's kind of what we've been seeing there.
And what do you do with them? So do you do a pre-screening or do you send them directly to a doctor? So tell me a little bit, how does it work?
When clients get referred to us, we do a pre-screening. We conduct the refugee health screener, and it's 15 questions that asks them about any physical or like trauma-related symptoms that they might be having. So like, are you having joint pain or headaches, or and then there's also a scale of where they would self-report their stress level, and I believe it within that month or so. And then from there, we make a recommendation for whether they need individual, family therapy, or and like how many sessions we would start off with and how often we would start them. So we do that. We also ask about like other needs that they might have. So we'll always ask about like kind of their financial situation or housing and just safety in general. And that's another thing that we've kind of uncovered, is that because a lot of people that are undocumented maybe, or even the ones, there are some that have work permits, but a lot of them will work like kind of just odd jobs, or they'll just pick up work where they can. And so with the pandemic, they're kind of the first to be let go in a sense. Like it's hard for them to be picked up for work when, you know, we're trying to avoid impact. So a lot of them have been struggling with that.
How much do you think the number of cases you work with has increased, or that your office works with has increased in the last 6 months?
Well, it's a new program, so it has increased. Well, we started off with 0 clients, and then now we have about 45, and we keep getting more, like 5 to 15 every couple of weeks.
Do you get to talk to them besides the screening survey?
To the clients directly?
Yeah.
Yeah, so sometimes I have a staff person that she does most of the direct service with the clients, but every once in a while, since it's just us two running the program, sometimes I'll cover sessions for her, or I've helped with some of those initial screeners. And then we're also planning on implementing some group education. So we're gonna do some group sessions on just like accessing community resources that they might be eligible for, how to, I guess, who to talk to within the school systems if they need help. And especially with the remote learning environment, a lot of people are struggling with explaining their homework to their kids. So, and then also like just talking about self-care in general during the pandemic and taking care of themselves and their kids.
And do you do that via the computer, via phone?
We do both. We do Zoom, or we do via phone, just whatever the client has as far as technology goes. We try to figure out what they have and then what we can make work, basically.
Have you received any cases, or you have information about any cases of people that do not have access to a reliable phone or a computer?
Yeah, we've had some that I guess more often than not, they'll not have Wi-Fi at home. So there have been times when we've had to help them figure out, maybe look for some programs out there like the Cox Connect to Compete program is a lot cheaper for families. So just helping them find affordable options, or some of them have figured out, yeah, like where they can go to access free Wi-Fi and things like that. But for the most part, all of them have phones or some kind of device.
And do you work either directly or the other programs you've been involved with other organizations that work with the Latino community or the immigrant community?
Yeah, so a lot of times to find resources for families, like we'll have to pretty well connected with like the Latino Center, or I have clients all the way in Schuyler and Columbus. So sometimes I'll have to call the Centro Latino in Columbus to figure out what resources are in their area, or in Grand Island. So yeah, we kind of have to network all over the map.
What have you heard about the impact of COVID on those organizations, mainly the ones in Columbus and Schuyler?
I am not super aware of what the issues are. Obviously, their philanthropic events have had canceled, or some of them have received some large donations, like the Angel Fund, and some organizations have benefited from that. But as far as like their overall impact, I don't really know. I know some of them are working virtually as well, but I feel like especially in towns where there is like a meatpacking industry. I know a lot of them were very busy trying to help people that were impacted from that.
Yeah. So you work with people that are in the Latino community mostly, and that live in South Omaha, etc. How do you think that COVID has impacted the Latino community in Omaha, from your experience, from what you've seen talking and working with these people?
I think a lot of them are stressed because of various factors, not there's the schooling issue, the language barriers there are really stressful for people. And then financially, I think that's probably even bigger because a lot of them, especially in mixed status households, or being undocumented, they're not eligible for things like the COVID stimulus checks, and they're not eligible for the CARES Act funding. And so I think a lot of them are just struggling to find some support in those areas. So yeah, from the people that I've interacted with, a lot of them just seem stressed, anxious, and depressed.
And so do you think that your program is going to grow if this pandemic continues, in terms of will you get more funding, or will you try to go out and seek for more funding to be able to service more people.
So I think we're going to do a little both. So we get reimbursed fee for service. So the more therapy sessions we can provide, the more reimbursements we get. But at the same time, we also, since it is a new program, we're just kind of starting to generate revenue, and we need to be able to pay salaries. So we are looking into opportunities to kind of generate operating revenue. And then also I just talked to somebody at a foundation to be able to provide emergency assistance for my clients. And so we were able to get a gift of $25,000 so that was really exciting. We still have to figure out the details, but my hope is that we can provide maybe like $75 to $100 per client to be able to buy what they need.
And this will be for non-health related needs. So if they need money for food.
Yeah. Yeah, it'll be, so I'll have to find out more from the actual award letter, but from what they told us, it can help pay for groceries, PPE, cleaning supplies. The unfortunate part is that rent and utilities are excluded. So that's going to be a struggle.
Mm-hmm. So how do you see your personal life and your work life when this ends?
I think that I think we're going to continue seeing work related. I think we're going to continue doing a lot of remote work, which I'm pretty happy about. I think we can normally, we would have only been reaching people within Omaha and maybe Council Bluffs. But now with this, like I can see people that are 3 or 4 hours away. And so I think that's really exciting. And that's across the organization, not just with my program. Personally, I don't know. I think I'm hoping to kind of start to, once this is over, to just be back to doing social activities and not have to worry about all of that. Because yeah, like I think my workload is pretty heavy, and so I spend most of the day working, and there's not much of a work-life balance. So yeah, I hope it kind of, once this is over, that balances out a little bit better.
Mm-hmm. Do you still have family in Mexico?
What was that?
Do you still have family in Mexico?
I can't hear. Breaking up.
Do you still have family in Mexico?
Yes, my grandparents, and I have several aunts, uncles, and extended family.
And what have you heard from them? Do you get in touch with them? And what have you heard from them about the impact of COVID in that part of your family?
Yeah, well, I think it's from what I've been able to talk to them about, is just since my grandparents they're elderly and not in the best of health, the family members do have to be a lot more careful where they go and taking precautions. And I think luckily though, they feel like they live in a more rural area too, and so they're able to kind of isolate from, a big crowded city or town. And so yeah, so I feel like they haven't been impacted super heavily, but they are still a little bit just they're cautious, making sure around our grandparents.
Mm-hmm. Mm-hmm. So those were mainly my questions. I want to ask you if there's anything else you'd like to share with me about your experience with COVID-19 that I have not asked you about.
Mm. I guess, I'm trying to think of something. I don't know.
So no other experiences.
No, I mean, I have been, I think, as far as working in the nonprofit sector or in such a large organization within the nonprofit sector, I do think that although we are kind of getting inundated with the requests for help, I do think that we're working a little bit more across departments, just because now everything's virtual and you can reach people. So, and it's just easier to get responses and things like that. So I guess that's one thing, that's one positive side of doing this. But yeah, other than that, like I think in social services in general, I feel like a lot of the workers are stressed. Just hearing constant stories and having to help so many people, and our case is growing and growing. So I think that has been a little bit of a employees overall.
Okay, so thank you very much for your time, and thank you very much for allowing me to interview you. And with this, I end the interview. I'm going to stop the recording now.